So next, I'd like to invite up Linda Holtzman, who's going to talk on new Desmoid ICD-10 codes. So for some of the people in this room who are clinicians, this is really important for coding and for actually reimbursing for clinical care. I'd say that probably the majority of the people here don't use ICD, don't take care of patients and don't use these codes.
Okay.
But she's going to give us some information that we can use and bring back more globally. Thank you.
Thanks. Hi, everyone. I'm Linda Holtzman. I'm a professional medical record coder, of all things. I assign ICD-10-CM diagnosis codes to patients from after reading and analyzing their medical records. All those letters after my name on your agenda, there are various coding credentials, but the one I want to call out to you is RHIA, Registered Health Information Administrator. That's a bachelor's degree in health information management, which is the academic field for coding. So yes, you can get a college degree in medical records administration, and now you've met somebody who has one, right? By the way, I also have a master's degree, and it's rather intimidating to realize I am the least educated person in this room. Okay. Anyway, what is medical record coding, and why do you care? Why do some of you care? Every time someone has an encounter with the health system in the United States, so whenever they visit their physician, if they go to the emergency department, if they get an x-ray, if they have surgery, if they have an inpatient stay, every single time their diagnoses are documented in the medical record. And then somebody like me comes in behind and converts them into ICD-10-CM codes. ICD-10-CM is the US adaptation of ICD-10, which is the international version by the World Health Organization. ICD-10-CM has been in use in the United States since 2015. So ICD-10-CM diagnosis codes have two purposes. First, they are used for coverage, billing, and payment. That is, those codes go on a medical record. They also go on the patient's bills and get sent to the patient's insurance company. And the insurance company uses them for example, to determine if the service is covered and how much the provider is going to get paid for that, seriously. And second, these codes are used for research. So government agencies and payers maintain these huge databases with hundreds of thousands of millions of records going back multiple years, and searching those databases enables us to identify people who have specific disorders and then do retrospective research. There are about 74,000 ICD-10-CM diagnosis codes, but many similar disorders are classified to the same code, and that's especially if it's a rare diagnosis. And that has been the case for desmoid tumor. Happily, on October 1st, 2023, which is just a week from today, or a week or so from today, ICD-10-CM will have specific diagnosis codes just for desmoid tumor. And as of October 1st, use of desmoid tumor codes will be mandatory for essentially all providers and all payers in the US. So let's see what those codes look like. Next slide, thanks. Seriously, this is what I do all day. Actually, first, let's see the code. Let's see the code that's currently being used for desmoid tumor. That's up at the top. It's all desmoid tumors are currently being assigned to code D48.1, which is defined as neoplasm of uncertain behavior of connective and other soft tissue. What does that mean, uncertain behavior? Uncertain behavior refers to tumors whose histology can't be formally classified as benign or malignant. And as someone mentioned earlier, desmoid tumors aren't malignant per se, but they are nasty, locally aggressive, destructive, and infiltrative. So that's classed as uncertain behavior in ICD-10 internationally, and also ICD-10-CM in the US. So this same code, D48.1, it's also used for other tumors beside desmoids, things like myofibromatosis, atypical myoxanthomas, angioblastomas, a few others. And the code is so broad that it's hard to identify that this is a desmoid tumor patient, specifically on bills and also in databases. But as of October 1st, we'll have new codes that will change all that here in the US. The new codes are D48.110 through D48.119. And you can see what happened. They took D48.1, which is a valid code as of today, but they, starting October 1st, it will become invalid as a code. It will now become just a category heading. So for those of you who are actually providers, who are MDs, who are billing, if you try to use D48.1 for your cases after October 1st, it will get rejected. Also, D48, you can see D48.11, that's new, but that's also not a code. That's a subcategory heading, okay? So the actual codes are the ones that are inside those red brackets. Starting October 1st, that's it. There are 10 new codes, 10, for desmoid tumors. And you can immediately see that they are specifically defined for desmoid tumor and exclusively defined for desmoid tumor. And also the new codes identify the anatomic site of the tumor. See those notes under D48.114 and D48.116, not in bold? Those are instructional notes to the coder. They're mandatory. They identify alternate sites that are also coded to that same code. So for example, D48.114 is defined for desmoid tumor intra-abdominal, but if the patient has a desmoid tumor of the pelvic cavity or a peritoneal or retroperitoneal desmoid tumor, that's the same code is used. That's appropriate. Also, multiple codes can be assigned if the patient has multiple anatomic sites. So say a patient has a desmoid tumor of the chest wall and also of the intra-abdominal area. So you would use D48.111 plus D48.114. Some people have asked what the difference is between D48.118 and D48.119. D48.118 is for other sites. So if you've got some kind of desmoid tumor that isn't in the list above, I can't imagine what that would be, but if it's some other site, you would use D48.118. D48.119 is identified or defined as unspecified site. Okay, and that means that the provider does not know, or the provider did not document the anatomic site of the desmoid tumor. Somebody laughing at that? Yeah, it's funny. I'm a medical record coder. Please don't make me assign D48.119. It's a default code. In other words, it's a trash code. And a lot of payers have trouble with an unspecified site. They might kick it back to you. I don't want to assign this code. So even though it might be when you're in the coding scroll in the medical record, and that might be the first code that pops up, don't pick that. Okay, document where it is, and also take the extra time, and it's only a few seconds, to say what the site is, the anatomic site. That's why we got those codes created, so we can get the kind of accuracy and specificity in the databases. By the way, D48.19 at the very bottom, that's also a new code. That's for all that other stuff that goes into D48.1 now, but is not a desmoid tumor. So how did these new codes come about? Next slide. The Desmoid Tumor Research Foundation submitted a formal request to the ICD-10 Coordination Maintenance Committee. You know, there was a committee like this, right? The CNM committee is a U.S. government committee. It's actually an intergovernmental group. It's responsible for maintaining ICD-10-CM in the United States. It's chaired by CMS, Medicare, and also the Centers for Disease Control. And it's the Centers for Disease Control that handles the diagnosis codes, or more specifically, there's an agency within the CDC. It's called the National Center for Health Statistics, that is staffed by physicians and professional coders. And those are the people who are on the committee. Committee meets twice a year. DTRF first submitted a request for new codes in June 2021. And we actually made it onto the agenda for the meeting. And that's pretty good by itself, because it's hard to get through the hurdles to get to the meeting. The proposal was actually well received, but the committee had some questions and possible edits. We didn't make it through the process the first time, but we're from that, so came back. The revised version of the request for a 2022 meeting in March. And here we're successful. So it basically took 2 years of work to get these new codes in, bringing it all to fruition. Next slide, please. So do these new codes have any impact internationally? The answer is not directly. As we said, the new ICD-10-CM codes apply only in the United States. However, there are other countries throughout the world which piggyback on the US system. In other words, they kind of figure like, why should we bother to make our own adaptation? We'll just borrow the US's because it's free and available online. So they may then consider adopting these new codes into their systems. Also, there are many countries that are already using the international WHO version of ICD-11. The US is behind the rest of the world in that. You can see that there are several codes in ICD-11 for desmoid tumor, but as you can see, those codes still lack specificity, the specificity that the US now has or will have. So it is possible that the new desmoid tumor codes in the US can provide some leverage to expand the ICD-11 international version. So the main thing here is, why did the Desmoid Tumor Research Foundation go through all this? Why does it matter? There are two main reasons. Next slide, please. First, specific codes for desmoid tumors should lead to reduced hassles for providers, for payers, and for patients. Wouldn't that be nice? If I can put it this way, ICD-10-CM codes are the administrative language of the US healthcare system. As we said before, they're used in billing, medical policy, coverage, payment, and being able to identify desmoid tumors specifically should improve the communication between the providers and also the payers. For example, a specific code for desmoid tumor explains why this patient needs this particular test or needs this kind of referral. Likewise, a specific diagnosis code links to treatments that are appropriate and expected for desmoid tumor. So they may not be routinely questioned by the payer anymore once the payer knows, yes, that's desmoid tumor. Once everyone gets used to the new codes, takes a few months, it should cut down on the paperwork and the red tape for physicians, for providers, and also help move the claims along through the payers' databases, so the physicians should get paid sooner, right? How do I know this? Because I worked for a payer for almost 20 years. I was in the provider audit department, but we don't have to dwell on that. But when we got a claim in with a diagnosis code for something like neoplasm of uncertain behavior of connective and other soft tissue, it was my department that got on the phone or sent an email to the provider, to the hospital, the physician, and say, why are you submitting such an expensive claim for such a vague diagnosis? Can I see the medical records? Can you send me a copy of this or that or whatever? And believe me, we didn't like having to stop claims. We wanted them to go through. And the provider certainly didn't like the fact that we had to stop the claim, but we needed to know, why are you asking us for $500,000 for neoplasm of uncertain behavior of other soft tissue? Now we won't have to ask those questions. And hopefully with the new codes, it'll move through much more quickly. That's the first reason why these codes matter. The second reason, better research. Right. ICD-10-CM codes are used heavily by researchers, especially retrospective researchers, obviously, to identify and track conditions nationwide within the US. And a unique code makes the diagnosis classification consistent across the electronic medical records, claims data, morbidity, mortality data, other sources. And that enables easier access and consistent access for researchers. And once we have these specific codes for desmoid tumor in the national healthcare databases, that will help researchers to more accurately define things like prevalence and to enable retrospective outcomes analysis. Next slide. I hope you've found this peek into the obscure but essential world of medical record coding both interesting and useful. And I'm happy to answer any questions that you might have.
Good questions. I think in particular for the people in this room who are doing research related work, it makes it much easier to pick out those patients, whether you're from the United States or somewhere else. We can have a philosophical and or political discussion about the way we pay for healthcare in the United States compared to the rest of the world, about why these codes should or shouldn't be used. But that's a whole different issue.
That's a different thing.
Did you have a question?
So
That's the first time anybody has ever called coding exciting.
Last 6 weeks, and it's just
Really?
so. How about the idea of going back retrospectively into existing records? Is there any prospect of that? Does the new coding framework make that easier in any way?
It's an interesting question because obviously you have longitudinal data. You can't go back and recode something because the new codes coming in, they're only effective from October 1st, 2023 forward. So you're still going to see those old D48.1s. But if you have longitudinal data and you can identify the same patient all the way through, then yes, the answer is yes. Go ahead. Yeah. Yes, it is mandatory for Epic and all the electronic health records as of
Yeah.
October 1st.
If it's coded the right way.
No, but it's available.
Go ahead.
It will be available.
It has to be coded the right way.
I just wanted to let you all know that we put these new codes in the natural history study starting in February. So the participants are being queried now based on these new codes.
Excellent. If I can just go back to the question, I'm sorry, I don't know the gentle lady's name. But in other words, if you key in Desmoid tumor in Epic, these codes will pop up and you will go down the list and say, oh yeah, this one for this site and this one. October 1st. Discharges as of October 1st or encounters as of October 1st. They are. The index of ICD-10, which I didn't get into here because it's even less interesting than the tabular list. But the index has been updated for that. So those will redirect. Yeah. Alternate terms are indexed. They're not necessarily in the list of codes with those specific definitions, but they're in the index, which, I mean, if there's 74,000 codes and there's like, I don't know, 250,000 index entries, and they will direct you correctly. Yeah, go ahead.
Resistance, it's just is that not going to be available, or is it going to just code to something that's not relevant anymore?
Well, if you just press for the prior diagnosis and it comes up as desmoid tumor, right? It will be linked to the new codes, not the old stuff. Okay.
So,
right. Waistband.
I do see one thing, because on individual Epic systems, people at different institutions might set that up differently. So there isn't like one way it's everything is done. So I can tell you, I know at our place, there's different ways that there's different ways that they match. So you should check and make sure that they're going to relink things the right way. Because
Sorry about that.
Someone at the place will have to do it for you.
I've worked at several of the top hospitals, tertiary care centers here in Philadelphia, and their systems were set up like that. So
Not everyone said they set up, people set up their voice. So I will say something that probably you all understand. So I'm an orthopedic surgeon, and you'll know that about 1/3 of all the ICD codes are in orthopedics, because they have all these different things.
laterality.
Us, it's a real issue. Like you get a fracture of one bone, and there can be, I'm not kidding, 25 different codes for the same fracture.
I have to look at those codes too.
Yeah, so it's a really important thing for how people do the billing, but it's complicated. Okay, great. Thanks a lot.